So let's look at the PERIO tip applications that Acteon has available. These tips are meant to be used with the glycine powder only. They are meant for subgingival use, for alternative to traditional treatment. They are no-risk treatment. They have better patient tolerance in pockets, less time than traditional methods is required, as we've said over and over, the 5 seconds. And these tips offer exceptional access to different types of periodontal conditions. So the first one is the PERIO maintenance nozzle. Now it looks the same as the nozzle that's used for the standard air polishing powder. However, it is for glycine use only and is noted by the laser marking on the back. And so the diameter of the outlet is much smaller than the standard nozzle to reduce the amount of powder flowing through the head. And the nozzle is used on all of the gingival sulcus area where the pocket depths are equal to or less than 4 millimeters deep. So to use for the patient that does have generalized 4 millimeters or less sulcular area, then the technique would be as these pictures show. And it's a great treatment for your typical adult prophy patient, whether there's gingivitis or healthy, and for periodontal maintenance patients with limited pocketing. And so what you do, you start with the recommended nozzle, which would be this one, and the glycine powder, and you hold the instrument about 2 millimeters away from the tooth surface, and you angle it directly into the gum line, which is counterintuitive, but angle it directly into the gum line or into the gingival sulcus at like a 30 or 60 degree angle, not quite 90, because you want to aim it at the root surface and the gingival sulcus at the same time. And then you just trace with the instrument, you trace the tooth kind of in a back and forth motion or a small arc or like a smiley face all along the area. And you remember that it's only 5 seconds per surface is needed. So you want to just, you know, maybe count it out a couple seconds this way, a couple seconds this way, and then move on to the next tooth. When you're working in the papilla, you still want to angle it in that same 30 to 60 degree. You want to angle the tip so that it is aimed between the mesial side of the root or of the tooth surface and the papilla, and then again right here and at 5 seconds. And you can just move it a little bit back and forth, holding it or up and down, and holding it just 2 to 3 millimeters from the tooth. And it's quite simple, and it's very comfortable for the patient.